What is disruptive mood dysregulation disorder? Disruptive mood dysregulation disorder is a childhood condition that involves extreme irritability and anger with frequent, intense temper outbursts. This condition goes way beyond the label of being called a moody child. As a result, these symptoms and behaviors cause severe impairment that usually require clinical attention. The child's irritability or angry mood occurs most of the day, nearly every day. The severe temper outbursts, verbal or behavioral, occur at an average of 3 times or more per week that are not appropriate given the situation nor the child's age. It is not out of the norm to see a 2-year-old have a temper tantrum when they can't have a piece of candy at the checkout line, but it is out of the norm to see a 10-year-old display that same type of behavior. Also, these observable outbursts have to occur in more than one setting, for example, at home, school, with friends, or other family members. Symptoms typically begin before the age of 10, but the diagnosis is not given to children under the age of 6 or adolescents over 18 years old. To be diagnosed with this condition, a child must have these symptoms steady for 12 months. The first step, if DMDD is suspected, is to have the child evaluated by a mental health specialist familiar with childhood behavioral disorders and discuss what treatment approaches may be best for the child. Psychological treatments are often considered first, with medication added later if necessary. Variations of behavioral therapy are found to be effective treating DMDD. In this approach, clinicians can use some techniques to teach children to regulate their mood and to increase their tolerance for frustration, and to teach coping skills for regulating anger, and to teach ways to identify and relabel their perceptions of the problem leading to the angry outburst. Parenting skills training is also used. This approach aims to help parents interact with a child in a way that will reduce aggression and irritable behavior and to improve the parent-child relationship. Some medications are found to be effective with reducing irritability, depression, aggression, and with preventing and or reducing the frequency and the intensity of angry outbursts. These medications include stimulants, antidepressants, mood stabilizers, and antipsychotics. I hope this presentation was useful. If it was, give me a thumbs up. And please help me to keep this channel going by hitting the subscribe button. If you have a topic that you'd like for me to present on, or if you have a question for me, please log on and submit it. I'll be happy to address it. Thank you and take care.